Hi guys, Dr. Keo here, and I wanted to make a live video for you today because we often are asked about what lab tests are important for people to have done so they can really have a good understanding of their health and how they can be as healthy as they can be and how they can identify issues before they manifest. So things like, how do I prevent different diseases like heart disease and cancer? So those are all things that people have on their mind and they want to know the answer. So that's why I felt compelled to make this video for you guys today. And we have patients a lot of times that we'll ask them to bring in their lab work for us, and when they do, there's definitely things that we could test further. Like there's things that are missing in my opinion. So I'm going to give you the top 8 tests that I think everybody should be having done on their lab tests when they go to their doctor. And then also making note, because you may want to ask your doctor to run these tests. They won't always do that, but sometimes all you have to do is ask and they'll run them. So make sure you ask your doctor, especially if you have lab tests coming up. And if your doctor doesn't run them for whatever reason, then come into our office because we have a phlebotomist on staff. She's here one day a week, and we can provide these tests for you. So the very first test is a comprehensive metabolic panel. So that's going to provide an overall picture of your body's metabolism and the chemical balance that is happening in your body. So very important to have. The second one is a lipid panel. So lipid panel is going to show us what the cardiovascular risk is for your body, as well as help determine whether or not we have issues with our diet, and we have to make changes in our diet. In the lipid panel, you're going to need to get a total cholesterol, HDL, LDL, triglycerides, and then if you have a history of heart disease, or if you have a history of heart disease in your family, then you want to make sure you get the apolipoprotein B done as well. The third test is C-reactive protein, CRP. So that's a measure of inflammation in the body, and it really should never be high. But if it is high, we have to ask, why is it high? So that's going to be looking at possible autoimmune conditions, infections, or again, the need to change our diet. The fourth test is a blood sugar panel. It's important to help us know how are we utilizing our glucose from day to day. So within that glucose panel, there's 3 things that we should have done. So obviously the fasting glucose is important, as well as a hemoglobin A1C. So that's going to measure our blood sugars over the course of a 90-day period. So that's going to give us an overall look at how we're utilizing our blood sugars overall. And then a fasting insulin as well. So those 3 things are important to have in your blood sugar panel. The next one, number 5, is thyroid panel. Very important. In our practice, we see a lot of patients, women in particular, that have been diagnosed with a thyroid issue, and they're on Synthroid, and they have been for a long time, and all they ever had tested was a TSH and maybe a T4. So there's no way we can properly treat somebody for thyroid issues if we don't have the whole picture of what their thyroid is doing. So when you get a thyroid panel, make sure that it has obviously the TSH, but again, make sure the TSH is within functional range, which is 1 to 2. The next is a free T3, free T4, as well as reverse T3. So that's a marker. If it's high, it can really help us diagnose underlying thyroid issues if your TSH, your T3 is normal. And then lastly, you want to have your antibodies checked as well. So that's going to indicate, if we have thyroid antibodies, that's going to indicate possible, Hashimoto's disease, thyroiditis, which is really important because that's a very, very common thing that we see in a lot of people who've been diagnosed with hypothyroidism. Test number 6 is vitamin D. In our practice, we love to have vitamin D levels at least 40, ideally closer to 60. So somewhere between 40 and 60 is optimum for vitamin D levels. And it's interesting because people that have low vitamin D, they're typically going to they're going to have more autoimmune dysfunction, other types of immune disorders, bone disorders, and mental health disorders. So vitamin D is so important, and it's so simple to check for. Test number 7 is a complete blood count. That's going to help us identify issues like iron anemia, B12 anemia, and if we have an iron anemia, we have to ask, why are you iron anemic? There's reasons that you would have iron anemia. And then test number 8 is a vitamin B12. Very, very important, because that's going to also let us know how well our stomach is working, how well are we absorbing our B12. Do we have dietary issues? Are we not eating enough B12? Or maybe we even have a neuropathy, or potentially a methylation issue, which could be related to MTHFR. So those are the top 8 tests that I recommend everybody have, especially if you are trying to keep a good handle on your health, and at least having done once a year, so you can really keep up and understand how your health changes from year to year, and just be proactive with your health. So if you have any questions on that, please reach out to us. Hopefully that was helpful, and don't hesitate to shoot us an email or comment on the thread or shoot us a private message, and we'd be happy to talk to you more. And if you need somebody to look at these lab testing with you, we're happy to do that. In our practice, we do a lot of that. So hopefully you guys got a lot out of this, and if you have questions, let us know, and we look forward to helping you on your health journey. Have a great day.